Thanks for meeting with me today. I've got exactly Tyson's file for you to have a look at. I've put together a rough assessment plan. He's coming in next week for his first session with us, and I'd love to run that past you if that's okay. So Tyson is a 14-year-old Aboriginal young person, and he has been referred to service as part of his bail conditions. It's important to note. Strengths and interests include boxing, he's a really physical guy, team sports, rugby, swimming, BMX. We should have lots we can get him chatting about, hopefully. Relevant history, we are looking at a kiddo with early childhood adversity. And he is currently living in out-of-home care. So I think they're the two big points I would like to flag. There is reported delayed early language. So he wasn't babbling much as a toddler. And there's been some disruptions to his education. Prior speech pathology involvement for early language delay. And in 2023, we've got a CEL-5 that reported mildly reduced expressive language capability and more significant receptive difficulties. Current concerns, he's experiencing a great deal of shame reading aloud, so I really want to prioritise that for him. Inferencing, text comprehension and school disengagement has been reported as well. Overall impression, I'd love your take on this. I think we're dealing with likely ongoing receptive, higher level language and literacy related difficulties, and all that within the context of trauma, cultural considerations, disrupted schooling, and justice involvement. So in terms of my assessment plan, I'm obviously going to be looking at using a trauma-informed lens, strengths-based and culturally safe approach, of course, prioritising rapport, keeping all of my explanations clear, and reducing shame and taking the pressure right off, obviously, because I really need to boost engagement. So I'd like to jump in really with a bit of a yarn, a bit of an informal clinical interview, get him talking about school, his experiences of reading, what his everyday communication demands look like, mates, interests, so that I can observe comprehension and expression. Gives me some functional information, obviously, but I think it also helps build rapport and hopefully gauge when might be appropriate to introduce something like, I've got a narrative retell task here on the list. I think I'd really like to look at sequencing and inferencing, but also cohesion, vocabulary and sentence organisation for school and functional communication. In terms of targeted language assessment, we've got the CEL-5, and I'd like to take a closer look at the exact results, what was working well, what wasn't, and use targeted follow-up, perhaps not full retesting, focusing on receptive language, higher level language, inferencing. Multi-step instructions are a big one, and verbal reasoning. It's going to build on known areas of concern and it keeps assessment efficient. I do need to hear him reading aloud. I need to hear that language-based literacy, understanding different text types, inferencing, because that is directly linked to the current referral concerns and it's important for his school and justice participation. Functional communication, I just need to look at how he's able to advocate for himself in the justice setting. Can he ask for clarification? Can he explain events clearly? And that's going to be relevant for school services and justice involvement. So I'd like to obviously take all of that, analyse any assessments that I can do through the lens of the ICF framework, and understanding that results are likely to be influenced by trauma, history, and justice context, and possible shame. So current knowledge and gaps. I'm feeling okay about the language assessment per se and looking at language within context. I feel good about that. I am feeling a little bit nervous. I'm not very confident perhaps with the adolescent population, and this justice context is obviously quite new to me. So question 1 I have for you is, how would you prioritise assessment if Tyson is perhaps reluctant to engage or can't really tolerate anything more than a short session? Because engagement may be limited. I don't want to over-prioritise formal testing. So what should I do first? Question 2, which assessment tasks would best capture functional communication needs relevant to justice involvement and not just school-aged language performance? I need to look at daily functioning and not just scores. Question 3, what are the most important indicators that Tyson's language difficulties may be affecting his understanding of legal or bail related information? I want him to be able to advocate for himself, but I need help looking for what those signs could be. And question 4, what referral pathways would be most appropriate if concerns extend beyond speech pathology scope of practice, which I think is highly likely.